Okay, so we have here the steps in the gas formation. So the first one, we have here the aggregation of your thumb horse whole protein to become individual protein fibril. Then after that one, you try to interweave in order for them to make here much of your gas matrix. So ganun, para makagawa siya ng ganyan. Then after that one, you try to solidify. You try to, okay, eventually try to solidify. And after that one, it will be incorporation of your urinary sediments. So for your gas matrix. Actually, our gas, they are identified here by whatever urinary sediments is being incorporated in their gas matrix. So like for example, kung ang naka-incorporate sa kanya, dito sa loob niya, is an RBC, so we call that one as your RBC Gas. Pag naka-incorporate sa kanya is your Wbc or your past cells, you call that one as your Wbc Gas. Kung bacteria ang nasa loob niya sa kanyang gas matrix, then that's your Bacterial Gas. Okay, then after that one, we have your detachment of your protein fibrils from the RTE. From the RTE, and eventually become here your gas. Okay, so we have here the closely related terms with our gas. We have your cylindroid. Cylindroid would have here the same significance as our gas. So they have the same morphology with our gas, only that your cylindroids being produced here at the junction between your ascending loop and your distal convoluted tubules. Whereas your gas, saan siya napoproduce? Again, that's in your distal convoluted tubules and your collecting ducts. Okay, actually, the presence of the gas in the urine, we call that one as your cylindroria. Hindi siya castoria. Cylindroria is the term for the presence of the gas in our urine. So, as a summary of the different gas, okay, so we start here with your Hyaline Gas. Hyaline Gas is the prototype of all your gas. This is usually, Hyaline Gas is wala siyang laman. Okay, then eventually developing here to become your cellular gas. So cellular gas includes either your Rbc gas, Wbc gas, or even your bacterial gas, or even your mixed cellular gas, which is a combination of the different mga cellular gas natin. Then we have also here your granular gas. To start with your fine granular gas, and you could also have here your coarse granular gas. And we have also here your waxy gas, which is considered to be the final degradation of all our gas. At after this one, meron pa siyang broad gas. Okay, broad gas. So we're going to discuss each of your gas. The first one, we have here your Hyaline gas. So the Hyaline gas, again, we consider this one as our prototype of all our gas. Usually your Hyaline gas is clear. So wala siyang naka-incorporate na cellular substance with this gas matrix. Okay, and usually your Hyaline gas may be seen here in non-pathologic conditions, like for example, dehydration, strenuous exercise, emotional stress. But in some pathologic conditions, your Hyaline gas may be present also along with the other gas. So it might be present here in your glomerulonephritis, chronic renal disease, congestive heart failure. Okay, the normal values for our Hyaline gas is 0 to 2 per LPF. Okay, then next we have here the Rbc gas. Rbc gas identified here by the gas matrix being incorporated by our RBC. And another thing dapat, if you are confused if that one is RBC or not, to try to check for the surrounding. Dapat may makakita ka na free na RBC. Free RBC in the surrounding. Okay, so like for example, itong urine natin, so dapat if you have this one gas na RBC gas, RBC dito, dapat makakita ka din sa labas ng mga RBC. For you to consider that one as your RBC gas. Okay, RBC gas is usually present in your bleeding disorders, like for example, your glomerulonephritis, and even in the case of your renal calculi or kidney stones. So, RBC gas also incorporated here or accompanied by the proteinuria. Pag may gas ang urine natin, expect na magiging positive ang ating protein test, chemical test for the protein, because remember that your gas, pinaka-main component niya is your thumb horse hole protein. Okay, so not only the Rbc gas, but your entire gas. Basta may present ng gas, expect to have here na may positive or positive ka sa protein. Okay, so this proteinuria, the present dysmorphic red blood cells. Again, pag sinabing dysmorphic na red blood cells, ito yung may fragmentation, may protrusion na RBC. Another one, you get here a positive chemical test for the blood, aside from your protein. Okay, then we have here the term, the blood gas. The blood gas here, so pag ang RBC gas natin, it begin to disintegrate, it begin to lyse, magiging homogeneous na siya. So, that kanina, di ba, kung RBC gas, we have your RBC. Pero pag mga ito ay nag-lyse, magiging homogeneous orange-red, we call that once your blood gas. And eventually, pag medyo tumagal pa siya lalo, once your hemoglobin within your RBC is converted here to your methemoglobin, magiging ano siya, dirty granular gas. Okay, so the next type of the gas we have here, your Wbc gas. Wbc gas is usually found here, identified by the presence of your Wbc or the pus cells within the gas matrix. And identification of that could also be aided here by the presence of your free-floating na mga Wbc outside of your gas matrix. Dapat makakita ka muna ng Wbc for you then to consider the outside of the surrounding of your sediment here under the microscopic field before you could try to correct or identify that one really as your Wbc gas. Because sometimes it would be difficult for you to identify kung ano talaga ba doon sa loob ng gas matrix natin. If that's really RBCs, that really are Wbc, or is that other cells. So dapat, for you to consider that one as your Wbc gas, then the surrounding you should find here your Wbc dapat. Ito say may free floating na mga Wbc. Okay, Wbc gas would help us differentiate with your urinary tract infection. There are two forms of urinary tract infection. One is the lower genitourinary tract. Pag lower genitourinary tract in the form of your cystitis, this one try to affect here infection, urinary tract infection basically in the bladder, urethra, ureter. But once the infection ay medyo nasa taas, like renal pelvis, renal tubules, it become your pyelonephritis. And your gas, Wbc gas, could only be present in your pyelonephritis because again, your gas ay nabubuo siya sa renal tubules natin. Therefore, this help differentiate between your pyelonephritis versus your cystitis. Although both of them would have the bacteria and the presence of Wbc, but your Wbc gas would only be present in your pyelonephritis but not in your cystitis. Okay, next we have here your bacterial gas. Okay, that's related to your bacterial infection, urinary tract infection, and it should be accompanied here by our Wbc gas. Identification of your bacterial gas could be made here by your gram stain, especially like for example, if you are confused if that one is your granular gas or bacterial gas. So pag bacterial gas yan, it will be able to stain your bacterial gas but not your granular gas. Although kasi pareho sila, para silang mga granules. Okay, so again, dapat makakita ka din ng bacteria, madaming bacteria surrounding of your gas, and then plus of course bacteria within the gas matrix for you then to classify that one as your bacterial gas. Okay, next we have here your RTA gas, so renal tubular epithelial cell gas. So basically, renal tubular epithelia, so basically they are originating from our renal tubules. So anything that would try to damage our renal tubules in the case of your acute tubular necrosis, because again of exposure to your toxic chemicals, heavy metal poisoning, then it would result to your RTA gas. Okay, the fatty gas would identify here the case of your high lipid concentration, in the case of your lipiduria, is in the case of your nephrotic stain syndrome. So they could be identified here by our lipid stain, Sudan 3 and oil red O. Again, it would stain your triglyceride and your neutral fats with orange-red droplets, but not your cholesterol. But then cholesterol is capable of polarization and Maltese cross appearance. And then we have also here your mixed cellular gas. So mixed cellular gas is a combination of the different cells. So like for example, in the case of your glomerulonephritis, you could find here the Rbc gas and even your Wbc Cast, or even Wbc gas and the RTA gas. In the case of your pyelonephritis, which is your bacterial infection, you could find here Wbc gas plus your bacterial gas. So nasa kanyang loob na kanyang gas matrix, may combination ng different cells, making that one as your mixed cellular gas. Okay, the granular gas, on the other hand, so they are identified here by the presence of the granules. So the granules here came from your lysosomes of the RTE. Okay, and we can classify that one as your fine granular gas and your coarse granular gas. So they are differentiated from one another by the structure of their or texture of their granules and the size. Pag fine granular gas, it would have here finer, smaller na granules. Pag coarse granular gas, we'll have here coarser and bigger na granules. Nakalagay sa book natin, it's not necessary to differentiate if it's fine granular gas or coarse granular gas. But when we are reporting the result in the urinals, we tend to classify coarse granular gas or your fine granular gas. Then we have also here your waxy gas. Your waxy gas just represent your hyaline. Just represent here your granular gas which stays in the renal tubules for extended period of time wherein ang kanilang granules ay nag-disintegrate, nag-lyse, na magiging waxy or highly brittle ang kanyang appearance. Okay, so this represent here the extreme urine stasis. Okay, mean to say may blockage sa ating renal tubules. And it's also represent here chronic renal failure. Okay, then we have also here some information regarding your Waxy Gas. So the Waxy Gas would have here high refractive index compared with your Hyaline Gas. Okay, so because most likely your Waxy Gas and your Hyaline Gas would resemble one another in terms of their morphology. Pag sinabing high refractive index, kahit maliwanag, makikita natin ang Waxy Gas. Your Hyaline Gas, kailangan natin na madilim na light. Or you need to reduce the light in order for you then to identify your Hyaline Gas. Another one, your Waxy Gas could also be identified here by having a fragmentation or jagged ends. Parang may ganon-ganon. Okay, sa kanyang side. Okay, that's what identifies your Waxy Gas. Okay, then we have here your broadcast. Your broadcast here represents your gas on which the width of the gas here try to widens. Mean to say lumapad siya to become your broadcast. So any of the gas, pag nag-widen ang kanyang width, then you consider that one as your broadcast. And we consider that one as your renal failure gas. But most likely, ang nagwa-widen lang, ang kanyang width here includes your granular gas and your waxy gas. Okay, the next one, we have here your urine crystals. So urine crystals could also be present in our urine. They tend to precipitate depending on several factors. Okay, some of your urine crystals here will just be amorphous. Pag sabing amorphous, para siyang sand lang. Parang dumi-dumi. However, here other crystals would assume here a true na shape. So some of them mga rectangular, oval. Okay. And precipitation of your crystal here is most likely depending on the following. So, okay, it might be because of your solute in the form of your organic, inorganic, or iatrogenic medications. So, pag sinabing medication or iatrogenic, so some of your medications you try to take in and eventually you are not adequately hydrated. Hindi ka masyado uminom ng water after you try to take that one, pwede siya mag-precipitate and able to form here your urine crystals. We have here the different factors to try to affect the urine crystal precipitation or formation. The first one, temperature. Most likely, nag-precipitate ang ating urine crystal here at a cold temperature. So if you try to ref your urine sample here, it might result in the precipitation of your amorphous substances, including amorphous urate and amorphous phosphate. Then again, we can classify your amorphous urates and phosphate in terms of their color of their precipitate or sediments. Amorphous urates would have here na pink na precipitate, whereas your amorphous phosphate would have here na white na precipitate. Another factor that try to trigger the precipitation of urine crystal, we do have here the concentration of your solute. I mean to say the more concentrated the solute here, so the higher chance of precipitation or the formation of your urine crystals. Another one, pH. So, most likely, organic solute and iatrogenic tend to precipitate in acidic na urine pH, whereas your alkaline pH would tend to precipitate more here mga inorganic solute natin. Except your calcium oxalate, because calcium oxalate is a urine crystal or the CaOx. Sa urine crystal, which tends to precipitate here in all pH. Pwede siya mag-precipitate sa acidic na pH, with your alkaline pH, or even in your neutral na pH. Okay, so we have here the identification of our urine crystals. So you can identify the crystals here. Number one, by the pH. So we can classify our urine crystal here as either those crystals here will try to dissolve or try to precipitate in our acidic pH. And we could also classify some of our urine crystals which try to precipitate in our alkaline pH. Another one, we could also identify here through their solubility. Okay, differentiation here between your amorphosiolates and amorphous phosphate. So basically, the amorphosiolate here, since both of them tend to precipitate when you try to ref your specimen. Okay, amorphosiolates usually tend to precipitate here or tend to dissolve when you try to warm your specimen, whereas your amorphous phosphate, on the other hand, tend to dissolve here not by your warming process but by addition of your acetic acid. So we have here some of the crystals seen normally in acidic urine. The first one, amorphous urine. Amorphous urine is a crystal here that usually this is acidic to pH and usually is being precipitated once you try to ref your urine sample. Amorphous urine under the microscope tend to produce here yellow-brown in color. It's granular in appearance. And if you try to check for the precipitate in the urine here, it would produce here a pink na precipitate. Okay, and because of its ability to bind with the pigment uroerythrin, that would enable that one to have here na pink na precipitate. Okay, usually your amorphosurate here tend to precipitate at a pH of more than 5.5. Uric acid tend to precipitate in much lower na pH, lower than 5.5. Okay, uric acid described here as rhombic, so meaning to say para siyang four-sided, rectangular, whetstone, four-sided rosette formation. Sometimes you could encounter also here uric acid which is six-sided or hexagonal plate. The hexagonal plate na uric acid, it might resemble here our cysteine, another crystal, and it could be differentiated from one another here by uric acid is capable of birefringence, capable polarization with our polarized light microscopy, whereas your cysteine crystal is not capable of polarization. So that would differentiate between the two. Okay, increased uric acid or precipitation the uric acid because of increased consumption of the purine-rich food. So mga legumes natin, mga beans, or maybe also related here to your gout, Leishman disorder, and we have also here some patients which are leukemic patients which has undergone here the chemotherapy. The chemotherapy here with the use of your chemotherapeutic drugs which are cytotoxic, they tend to destroy the cells in our body. And therefore, di ba, ang ating nucleus ng cells natin may mga nucleic acid. So, pag madaming cells na na-destroy, much of that purines were able to be excreted that become here your uric acid. And eventually resulting also here to your uric acid crystal precipitation in the urine sample of the patient. Okay, then we have also here your acid urate. Acid urate here resembles your ammonium biurate which has the spicules. So, only that your ammonium biurate ay nasa alkaline pH. So, if you happen to identify the presence of your urine sample na may spicules, so for example, ito parang ganon, mga spicules. Okay, if that one is in the acidic pH, that's your acid urate. But if that one is in alkaline pH, that's your ammonium biurate. Another one, we have here the sodium urate. So it's a needle-like crystals. Most likely, your sodium urate could be identified in your synovial fluid. However, here in the case of your gout, pwede siya mag-leak pa din. If the patient would have the gout, it still eventually leak out in your urine sample. So it become your sodium urate. Next, we have your calcium oxalate or CaOx. Calcium oxalate appears here in two forms. One is your dihydrate, the other one is your monohydrate. Your dihydrate is colorless, octahedral envelope, or it would assume here parang two pyramid bases which try to join on their base. The monohydrate na calcium oxalate na form usually is the oval, the round shape, or the dumbbell na shape. Okay, increased calcium oxalate precipitation here would eventually, in the case of your increased oxalic acid consumption, like in the case of your asparagus, tomatoes, or even in your ascorbic acid. So we have here pathologic form of your calcium oxalate. The monohydrate usually tend to precipitate in the case of your ethylene glycol poisoning or your antiphase poisoning.